after you've given birth, you're never going to not have given birth. You will forever be postpartum. Things you should never say to a woman who's just given birth, ever.
Exactly.
Oh, I wish someone had told me this. A lot of us carry these stresses and emotional traumas in our body in different places, you know. If you can't have a complete healing, you're not going to heal properly. They leave the hospital and they're like, you're actually letting me take this baby home, but I don't know what I'm doing.
Welcome back to In Motherhood. Today we're talking about something that many of us women quietly struggle with, healing our bodies after giving birth. Many of us talk about bouncing back, but what does true healing really look like? And let's not forget we have this emotional rollercoaster ride of emotions. Our guest today is someone who helps women go through this journey. Laura is a senior physiotherapist and pelvic health specialist. She specializes in helping women through all common pains, body aches, and pelvic health challenges, empowered and to be in our bodies again. Laura, I would love to ask you, what sparked your interest in women's health?
Honestly, anger. I got so very tired of hearing about how Western medicine especially was failing women. You know, hearing that it takes on average anywhere between 7 to 10 years to be diagnosed with endometriosis, where women aren't being taken seriously for the pain that they're in, where we're being dismissed, where we're not being included in medical studies on medication because our hormones fiddle with the results too much until the 1990s.
Were you a teenager when you experienced this anger?
No, you know what? It's one of those things that the older you get, the more angry you get.
Oh, when did the anger start?
Yeah. Oh, well, to be fair, the anger started in my 20s, so I wasn't that old. But what happened is that I'm quite a pragmatic person. So I don't just want to get angry about it. What can I do about it? What can I actually do to help people? I don't want to hear about another woman saying to me, "Oh, I wish someone had told me this." So that's what it started. It started as me wanting to help women because I could see that there was a need and that we weren't having the help that we were requiring. So instead of just complaining about it, I wanted to do something about it.
And this covers women health, not just to do with pre and postnatal, but just in general.
I don't just do pre and postnatal. It's a big part because obviously there's a huge and significant physical as well as emotional change at that time. But I see a lot of women, as you said, for pelvic health issues, and that can vary anything from things like urinary incontinence, fecal incontinence, pain on sexual penetration, all of these issues that don't necessarily need to be tied to birth or post-birth or anything like that.
It amplifies maybe a little
It
bit.
absolutely can. It can really, some of these issues can be introduced after you've given birth. They've never had a problem before, and all of a sudden now they have this problem. Some of them are exacerbated by the number of kids you have, but it's more about just explaining to women and getting them to understand that there's so much you can do, that you are now resigned to this, you know?
Yeah,
It isn't like, oh, you had a
exactly.
baby, well, you're gonna leak.
And so many people assume it's normal to have this pain. And heck, I sometimes still have this back pain that comes back to me every now and then, even though I've worked with a physio for a year already, you know? So why do you think so many women struggle with this?
There are so many issues to this, and it becomes quite complex. So let's look at for example, becoming a mum. All of a sudden, your entire world has shifted to make sure that this teeny tiny person is kept alive. And you're pretty significant in that. You know, so many mums will tell you that when they leave the hospital, if that's where they choose to have the baby, they leave the hospital and they're like, you're actually letting me take this baby home, but I don't know what I'm doing. I don't know what I'm doing. You can't possibly expect me to do this. They're so focused on keeping baby alive, you know, especially, you know, that first time mum. Are they breathing? Are they breathing?
Yeah,
Are they
oh my
breathing?
gosh, the anxiety.
Are they breathing? It's like, oh no, but are they definitely breathing? No, I'm fine. But I'm just going to just gently check if the...
And the hospital comes back with this list of SIDS, like you suddenly have to worry about sudden infant death syndrome. And we're like, what?
So you're going to spend the entire time being like, oh no, that's fine. I'm fine. I've just put him down or her down. It's okay. But are they still breathing? I
Yeah.
haven't slept in 16 hours. I'm just going to quickly sneak in there and just check if they're breathing. And oh, I've woken them up. Oh, I've woken them up. No, 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 no. Why did I do that? This is all what drives us, and
Mm,
all of a sudden, our own well-being gets just pushed to the side.
yes.
Let's focus on the pediatrician appointments, the vaccinations, are they pooping enough, are they drinking enough, is the latch correct, is the breastfeeding going all right. It's so much about having the baby taken care of
Mm.
that we're just like, oh well, it's fine, I'll be okay, I'll be okay. So very often we push it to the side, we'll get around to it. Oh, it's just something that I'll do later, and we don't prioritize ourselves.
To be fair, I only saw a physio after baby turned 1. So I'm guilty. I had no idea. But I was so surprised that in France, it's compulsory for women who have just given birth to go and see a physio for at least 10 sessions. I wish they implement this worldwide, it's like a universal need.
It's pretty shocking that exactly as you say, that this is a significant change your body goes through, and in many cases a trauma. If you tear your perineum, it's a muscle tear, unless it's a grade 1, which is mostly just skin. You've had a muscle tear. In most situations, we'll be like, oh, muscle tear. Okay, so you have to go see the physio. But this, they're like, no, you're okay, it'll be fine. And then we're wondering why we're seeing such high levels of incontinence later on in life and prolapse issues, because there's so much more to it. It's not just one small, insignificant kind of thing. This is a very complex
Yeah.
sling of muscles. It's a very complex system that works all together.
Yeah.
We've really got to take the time to get it right. And that's just based on, like that's a small comment of a perineal tear. There are so many more things to it. Just being pregnant changes it.
So, when I had appendicitis, where I had to remove my appendix, I was given 6 weeks to 2 months of leave and asked to lie down and not move for the whole period. But when we give birth, it's not just a small minor surgery. We actually go through, like, some people go through C-section. I mean, the size of that, and then, as you said, the tear at the bottom and bleeding for 6 weeks. And then when we come home and we just given baby, and we don't have time to rest.
Yeah.
And then if the dad fractures the ACL, they have to be like on the bed and resting, but then mama will be off to the races with the little one, basically.
Oh, yeah.
So what does good support look like, Laura? Like, how do you help them feel better?
Well, good support has to be multifactorial and with a huge number of people, actually. When people always talk about, and I think we've discussed this before, when people talk about it takes a tribe to, raise a baby.
Absolutely.
The tribe is for mom. The tribe is not for the baby. The baby just needs mom, essentially. Dad's input, obviously, as well. But really, that tribe is there for your mom. And it's because, first of all, the physicality of it is huge. And unless you've been through it firsthand, it's difficult to comprehend how challenging it is. And that even if you've been through giving birth a number of times, each birth is different, each pregnancy is different, and you can have 10 kids and have 10 very different pregnancies and births. And what we need to look at is how women need to be supported in their own environment. So good support is good partner support. You can be the best partner in the world, and you're still going to get on mom's nerves, because unfortunately that's just life. You just don't understand because you just haven't gone through it. But you have to be there irrespective. The partner has to be there irrespective to help give support. And that partner can come in the form of anyone. It can be, the other parent. It can be somebody who's just there to support you. It can be a friend, a lover, a sibling, somebody who's there to support you as a partner.
I love what you say about how the village is actually for the mom and not for the baby. I don't think I got this till many years later. I always thought that, a few of us need to take turns to take care of baby, and the tribe is for the baby, not for me. And oftentimes they forget, nobody pays attention to the mom, people usually pay attention to the baby.
Yes,
so
indeed.
to get this concept, I feel is so important.
Once you're there and you're seeing it, you then realize how much actually needs to be done. So I often say to my pregnant mums, okay, so what we're going to do is be preparing you for after birth, because yes, we can do lots of perineal prep. For example, if you're planning a vaginal birth, or if you're planning a cesarean section, or you have to have a cesarean section, I show you different ways of preparing and getting ready for that, for
That's so
post-surgery.
good.
Oh, absolutely, it's very important.
Is that a checklist?
Girl, there are several checklists, but the reality is that I always individualize it. So I can give somebody like rough ideas on like, okay, if you're having a C-section, you need to first of all hear about wound support because
Mm,
often, unfortunately, in hospitals, they don't emphasize how important the wound support is. And for moving around, that can make a huge difference
yeah.
for coughing, for sneezing.
Yes.
Even if you need to poop sometimes, the wound support can be pretty critical. So that aside, I try and give them individualized ideas on what they need to do. But I also say to them like upper body strengthening, for example. So because when you've had the baby and that support you need is, can I physically hold this person for hours and hours and hours and hours and hours? And yes, there may be only 3 kilos or something, but that's 3 kilos over hours and hours and hours and sometimes compromised position.
Mm.
So you need then somebody who's going to help you with like muscular release. So that can come in the form of, postpartum massage, but in the right kind of way. Seeing a physio, lactation consultants are really, really important because breastfeeding is hard. Breastfeeding is hard. Don't worry about the birth. The breastfeeding is hard.
Yeah, in an earlier episode, Wanda also stressed this. So we need to listen to this warning, mamas.
Because if you don't realize that it's going to be challenging, you think that you're failing in somehow. So many mums are like, oh, well, it's because I don't really know what I'm doing and I'm meant to be able to do it. No, it's no longer intuitive. Back when we were living in tribes, women would be breastfeeding continuously and you'd see it from this age all the way through women breastfeeding. It's no longer what we do. So we think it's meant to be natural, but it's no longer in our remits any longer. So we have to be taught. It's a skill that you have to be taught. And you have to be prepared that there's no way you can fully prepare for this, but having a good lactation consultant, can't recommend it enough. And that's really going to be a help and a support. And then you need, sometimes the best thing is a few other mums, roughly the same kind of point of view, that you can just have a good old moan to.
That's good. Like just to let it out, an outlet.
Yes, absolutely. And because when you spoke about the hormonal roller coaster, people don't understand how significant that hormonal roller coaster is. By the time you give birth, your estrogen is roughly about 1,000 times its normal level. And then 3-4 days later, after you've given birth to the placenta, it drops off a cliff. So that's when people talk about, that day after, and you're like, oh my God, oh my God, oh my God.
I really want to highlight this issue, Laura. You know how when we are coming back to recovery after giving birth, we are just told to just rest. Everyone was like, don't worry, the nurses are taking care of your little one. You need to go and rest, or the confinement nanny is taking care of your little one, or your mother-in-law is taking care of your little one. But we, as moms, I remember feeling like I wanted to get back to fitness, get back in shape, and I just want to move and I want to reclaim my strength again, that urge of wanting to do and wanting to move and fitness versus just resting.
And this is where I say it also completely depends on the individual. Because there are some mums who feel that when they're pregnant, they're going to want to get right back into it. I've had some mums tell me it's like, oh, well, I'll go crazy if I don't do my exercise on like day 3. And then they get there and they're like, oh, yeah, no, I'm too tired. So it completely depends on the individual. I hate the term bounce back. Hate it, hate it, hate it. Because after you go through adolescence and you go through puberty, it's a significant hormonal shift and no one ever says to you after puberty, so when are you going to look like you haven't gone through puberty?
That's such a good point. I love this analogy.
So if we go through that, after you've gone through puberty, you're never going to be prepubescent again.
Yes.
After you've given birth, you're never going to not have given birth. You will forever be postpartum.
I've never looked at it that way.
So why do we expect women to look like they haven't had a baby? So first of all, I loathe that concept, but what I am all for is exactly what you described, regaining the strength. Feeling that you can regain the strength, feeling that you could be how you want to feel. Because I've experienced this personally. I would go to the gym about 3 times a week before I got pregnant. My pregnancy was actually quite difficult, so I was very challenged in the gym. I'd be there sometimes and just doing like body weight squats and fighting the urge to vomit. So it really wasn't the pregnancy that I'd envisaged. And then after I gave birth, my hope had been, okay, right, well, I'm going to get back in. I know what I'm doing. I'm going to get back into the gym. And it just hasn't worked out that way for me. And it's incredibly challenging because when you have had strength and you feel a certain way, to not have that, it's very disempowering, you know? I don't want to feel like it's a challenge for me to squat down, pick up my son. I really want it to be that that's no problem, like it was before. When I walk up the stairs, I don't want it to be an issue. When I get up off the floor from playing with him, I don't want to feel like, oh, my hips. I hate that feeling.
It's a disappointment in yourself.
It can be. And we really need to kind of shift away from that as well, because your body's gone through a lot.
Yes.
And so we just need to give ourselves grace. And as women, especially if we're the millennial age of having been told, you can do it all. You can do it all. You can do it all. Just do it all. It's very challenging because I think we hold ourselves to such a high standard as well that we feel that we need to achieve this all. We need to have the full career. You know, that saying of parents like you've got no job, work like you've got no kids, and wife like you are just there together.
These are the societal pressures and expectations that people put on us, right?
Yeah.
But I want to go back to how you were saying you had a difficult pregnancy and you mentioned that it wasn't what you expected. I feel like this is a resounding topic to most people. Like, every one of us have this idea of how pregnancy should look like, how motherhood should look like. And all of us will go through that drop in disappointment because it's not how it turns out to be. Like, and I don't know how to resolve this really, other than talking about it and creating awareness.
I think that's the only way you can, because so many times I've had pregnant mums come in to see me, you know, and they feel ashamed because they're not loving every minute of pregnancy. And the reality is, I've spent more time with women not loving pregnancy than women who do love pregnancy. Yes, sometimes you get these women who absolutely glow through pregnancy and they breeze through it and it's wonderful and it's fantastic. And that's amazing. And we hate them just a little bit, because for many women, it is a challenge. It is difficult, you know, and that difficulty presents in so many different ways. So obviously, I help a lot of women with pain and with discomfort. So that can be back pain, pelvic girdle pain, knee pain, neck pain, all these different pains that are exacerbated because of the pregnancy. And obviously at that point, and I'm really conscientious of trying to help people, because when you're pregnant, you can't really take any painkillers. And if you're in pain and you get told, oh, it's all right, it's only during pregnancy. Yeah. Those are the longest months of your life then, because to be told, oh, it's okay, it's just a bit of pain, it'll end when you're not pregnant, it's not an answer. So I really, really do try and help my pregnant mums as much as possible, because I know that with the physical release of most of these issues that I can help them. It's not a permanent fix, but it's a temporary reprieve that really can help us get going with the exercises. But the pain is something that always needs to be addressed. In my situation, I was struggling with migraines, really awful migraines that were resulting in me vomiting uncontrollably, not being able to be in any kind of light, not being able to look down at my phone. I had to go to sleep. I had to go and sleep or try and sleep. Sometimes the migraines were so bad, I couldn't actually lie on one side or the other. These were hormone-driven migraines that meant that there is nothing they could do.
Laura, now that you're a mom, how do you feel like this has changed the way you support women in your role?
It's an interesting question for me particularly, because whenever I would be dealing with my first time or any of my mums, to be honest, pregnant or postpartum, and we'd be talking about the different challenges that they're facing, what they would be saying to me is, oh, okay, and how many kids do you have? And I'd say, none. And it was literally a shock every single time. They'd be like, none. I'm like, no, not yet, unfortunately. And they're like, but you know all these things. And I'm like, yes, I'm not there yet, but we're getting there, because our journey was an IVF journey. So they were like, oh, okay, you're going to be so ready. And I'm like, oh, no. All that my job has taught me and dealing with all these pregnant women is that I know I'm not going to be ready, but I know who to ask when things go wrong. That's what my benefit was.
That's so important, though.
That's what my benefit was. I knew who to ask. All that's really changed from my perspective with being a mum now and doing my job is the very clear emotional feeling I can feel from my mums. You know, prior to that, I could really empathize and see it. But now when I see a mum struggling, I can feel it in my very being. And it has like almost an emotive response for me now where it wouldn't have had so much before, because I've been there and I know that pain and I know how hard it is. And I know the weight of the guilt, the challenges that you're facing if you're struggling to breastfeed, the struggle that if you have to stop doing something or change something or adapt to what you thought you would never do. I feel it in my bones now.
Yeah, I would love to expand on that. It makes such a big difference that you now truly get it, not just clinically, but from lived experience. And I can imagine how you're holding space for so many women, these women that come to see you to treat their physical pain. You're able to address the emotional side of it as well. This leads us to really putting thought into the emotional recovery versus the physical recovery. But is this really a versus, or do you feel like they're both equally important?
Without a shadow of a doubt, both equally important. Both equally important, because you cannot have a physical resolution without an emotional one, because very few people realize this, but a lot of us carry these stresses and emotional traumas in our body in different places. You know, if you can't have a complete healing, you're not going to heal properly. It's
And
not
complete
just
is emotional, physical, maybe mental.
completely. And that's why I've often said to mums, you know, they come and they see me and it's a very emotional time for them when I'm doing, like, I'm there to fix their neck pain, upper back pain, pelvic pain, whatever it is. But there's so much emotion that I can see in there. I mean, I regularly say to them, look, I think you need to also have a chat to somebody, whether it's a counselor or a psychologist or a support group or something like that.
And I can imagine that now that you're a mom, they would open up more honestly.
It's so important. And sometimes because I have been there, because I've done this, because I've also just seen lots of mums, I can recognize when someone is struggling and maybe they don't really know how to put it into words, or they're struggling to just kind of bring it out. And so sometimes I will just gently probe, and I'm the first person who asks them these kind of things. And then as they realize there might be a bit more depth to it, that's when they start to think, okay, well, maybe I should go and chat to someone, maybe I should go and
Need to
see
give more
someone.
attention to this.
It's
Yeah.
it's so
That's
so
so
important.
powerful. I feel like I was personally really surprised at how slow recovery took me, like the healing part of things. It took so long. Even just coming back from the hospital, my stomach was the same size as it was before I gave birth. And I remember someone said, "I thought you just gave birth." I'm like, "Yeah, I did." Like I did, but
Things you should never say to a woman who's just given birth, ever.
exactly. Please be mindful. Yeah. So in that sense, like I feel like yes, I agree with you. It's so powerful that now you can help women not just physically but emotionally as well. Thank you, Laura. I would like to go into like you can see the gaps from your work and what is available for women postpartum. You know, what is something that you would love to see in the future happen for people in the future to continue healing or heal better?
Well, in order to heal better, I would actually say prepare more. So, what we're looking at is getting you to get as strong as you can in pregnancy. Keep that strength there, because that's really going to help you significantly afterwards. So, if you can, get as strong and as fit as you can during pregnancy. Be prepared that afterwards you will go and see a physio, or depending on the country you're in, a midwife or something, to do some pelvic floor rehab, because C-section or vaginal birth, you need to get it reviewed, and find somewhere that you can open up and be able to chat to.
No.
Exactly. So I went to a postpartum new mothers group, and I really loved that. It was so wonderful to be with other mums of roughly the same age, like I said, babies with the same age,
Yeah.
and be able to be like, this
I
is
don't feel so
hard,
alone.
and I don't feel so alone. So that's
Yeah.
really important. So try and get yourself a bit of everything
Get
in
support.
preparation. Get support. And the more support you can find while pregnant means that you don't need to go looking for it afterwards. You know where you're going to go.
You know, you support so many women, and I feel like that must be a lot for you to carry on your own. So let's wrap up with something fun. Like, what is something you do for yourself? A self-care ritual, or, you know, some your favorite recovery, rest and relax and recharge
Well,
moment.
there are a number of things I like to do. I love my audiobooks because it's something I can listen to anywhere and everywhere. I do enjoy a good glass of wine, but what I really love when I really feel like pampering myself is a really good foot massage. Oh,
Oh,
you know, when
especially after giving birth, now you can have all the
all the
foot
foot
massages you
massages.
can.
Yes. So a really good foot massage where I'm questioning why I've done this. It's so uncomfortable, but then I know afterwards it's going to feel so good.
I kind of like the pain a little bit.
Happy pain. Happy pain.
Just to wrap up, we know that postpartum care is not just about physical healing, but really about the emotional as well. And it's totally not about bouncing back. Please drop that from your vocabulary. If you've been listening to Laura, it's a whole new person that you're gonna get back into. And Laura helps, you help people to feel whole again, I feel like. So I really thank you for sharing your story today. And I know so many women will feel seen after hearing this. Thank you.
If you are struggling, especially if you are pregnant or postpartum with physical pains, musculoskeletal issues, any pelvic floor issues, don't suffer in silence. Reach out. Come and find me. You'll be able to find me through the podcast.
I really enjoyed Laura's insights into how physical recovery is not just physical, but emotional as well. She has worked with countless women through their journey. And this is such an important takeaway for me. This conversation reminded me that it's so important to reconnect with our bodies and hold space for our emotions and feelings as we go through this journey, and that you really deserve real support. The part where she shared about her own reflections on her motherhood journey, it goes to show that you can read and have all this knowledge, but you're never really ready, and that's okay. If you're enjoying our content, don't forget to like and subscribe and support this journey of conversations in Motherhood.